Hello and welcome to the WBCC, EDP and Wyoming colorectal cancer screening programs update and provide a listening session for February. This month we will be going over the Colorectal Cancer Awareness Month items and resources that you can use next month to raise awareness about colorectal cancer. And just some general updates for those who are going to be viewing this recording from the office. Please continue to submit claims with attachments before the 30-day suspension is over to avoid claims being denied and needing to be resubmitted. So please do get those sent in as soon as possible. And if you have any issues, please do call the Medicaid provider portal. We also have established a monthly series of topics to cover. So each month will be a specific topic. And at the end of this presentation, you'll see the list of all of the topics and when they are coming up with the meeting link, the same one that this meeting is on. And also, again, when you do join these meetings, we do welcome conversations about any topics that come up, and they can be off recording. So we'll have a recorded piece that we can use for the future, and then a question and answer session if you have anything you want to talk to the cancer program team about. Okay, so for our first slide here, we're just going to go through some of these items about there are some changes to the colorectal program that will be coming soon. So please stay tuned for news from the cancer program, exciting news about developments coming soon. Just some updates about our program as it is right now. Currently, we have a rule set that if you're 50 and older and you're at 250% of the federal poverty level and you have a history of symptoms and so on, then you would need to have cancer screening. So we do recommend that anybody who is eligible apply for the programs in order to receive cancer screening. It is very important that we find cancer early when it's small and it hasn't spread. Often this allows for better treatment options to happen. And the quicker we detect these cancers, the better people have chances to survive and to live a long and happy life. So for the Colorectal Cancer Awareness Month, there are some resources that we'll show on the following slides, some of them from the Colon Cancer Coalition website and for the Colorectal Cancer Alliance website and our other websites as well, which will help you can print off and you can use these in your provider offices to help your campaigns over the next month. And as the star says there, 1 in 24 people develop colon cancer during their lives. So it's very important that we do detect them early. So all the links will have a PDF version of this as well, as you can access these links. But this is the Colorectal Cancer Alliance. I'm sure you can access via a search engine. So one of they have all of their social media campaigns, but one of those is on March the 3rd. They have a Dress in Blue Day. So we recommend that's something nice and easy that people in the office can do. Dress in blue on March the 3rd to raise awareness for colorectal cancer and to raise awareness for people to get screened for colorectal cancer. So I would recommend that you check out that website. And again, the links are all here. Hopefully this will pop up. No, it won't pop up. But we won't go to the website in this one. So some of the items that they have brochures that you can download, and some of the other items in this website are not currently available, but the brochures, you can see the advertisements there, which may be useful. Again, feel free to browse, download, and to utilize these. So from the Wyoming Cancer Coalition, there are some resources available right now, which will be updated throughout the month of the Colorectal Cancer Awareness Month. But these were available last year, and they're still great resources with those statistics. Again, eye-catching posters about catching these cancers early and so on. And this is a screenshot of that website. So again, the links are all in these slides. So please do check out the Cancer Coalition website and use these posters and print them off and for this campaign. And so as part of the George Washington University, they have some good things that you can put in newsletters, and you can promote if you're talking to patients about cancer screenings this month, about the benefits of screening early, and why it is important. So if you are sending out messages or in any newsletters, messages should highlight the fact that a person can prevent colorectal cancer through regular screening. Such messaging can also address the fears of an unfavorable test result, which we know is one of those main barriers. People don't, if you don't know, then it's not going to hurt you kind of approach, which is not the right approach. So getting through these barriers and talking to patients can help overcome these fears of what will happen if the test results are negative. What can they do to get that treated? And so as part of the Colorectal Awareness Month, we would like to go through some of these recipes to have a healthy colon, and some advice that our nurses have provided and consolidated for us. So I'll go through these now. Of course, eating plenty of fiber is the most important item there, that we must make sure that we have good fibrous diet. Avoiding those processed meats like deli ham, sausages, jerky, etc. Anything that's processed is kind of carcinogens and so on, and it's best to avoid those processed meats. The best kind of meats that you could have in your diet are chicken, fish, turkey, and of course the vegetables and nuts and seeds and the legumes and so on. And moderating your alcohol consumption as well. High alcohol consumption has been related to poor colon health. So all of these advice and tips you can put into newsletters and so on, talking to patients. Eating lots of fruits, but also avoiding the fruit juice, because again, it's that fiber content that's most important. Fruit juice eliminates all of that. You just get all the sugar and none of the good stuff. So avoiding fruit juice is good. A great website to get healthy recipes is eatingwell.com. So I would recommend that you go there and look for some good recipes for maintaining a healthy colon. And again, the star there with the statistics is colorectal cancers are number 2 in the cancer-related deaths. So still very high and still treatable if caught early. So it's very important that you talk to your patients and go through and use our program to get those colorectal screenings. So as part of the National Colorectal Cancer Roundtable, they have started an initiative called the 80% Screening Pledge. So this can be to obviously get clients to be screened, but also for employees in the offices around where you are. And it's to encourage everybody to try, in the organization, to try and reach that 80% benchmark to get screened. Now, there are a few places in the state which have already joined up, and that's fantastic. We have Cheyenne Regional, who joined up, Campbell County Health, Memorial Hospital of Sweetwater County, St. John's, Summit Medical, and the WCRS have pledged to reach 80% screening rates. Again, it could be for your clients, of course, but maybe this could also be for your employees. It's important that this is just, and also be aware, this is broader than just our colorectal screening program. This 80% pledge, this is a statewide, nationwide effort. And these are the organizations in the state who have pledged to try and meet that. And we commend them for that. It's hard to try and get people to get through to these screenings. It's a lofty goal, but it is, it's an ideal goal. It's something that we should all be striving for, to have as many people to get this, and it's commendable for all of these organizations. So we hope that we can have some more organizations join up for this 80% screening pledge. The website is there, the NCCRT website, for all of the information about this 80% screening pledge, or you can contact the cancer program. We'll put you in touch with our nurses who know more about that. Okay, so just a reminder, please sign up for the newsletters. You can find under the provider information section of the cancer program website. You can find the link to join up for our newsletters, when not just the screening program news, but all other news from the wider program will be sent to you as well. And of course, our Wyoming Cancer Coalition monthly newsletter, you can please do sign up for that. And if you are interested in joining the Cancer Coalition, reach out to the Cancer Program, and we'll be happy to help you with that process as well. So the next session will be of these video recordings and the live sessions as well. So you can actually get that live input from the staff here, ask some questions again after the recording period is finished. The next one is on the 21st of March. This one will be a billing specific presentation from Terry Wesenberg and Megan Westphal, and they will present to you all aspects of how to go through the billing with the least problems and making sure your claims go through smoothly, and it's all roses at the end. So please see the video information there. The link is the same as the one that was today. It will be the same link going forward. The times will differ slightly. So also you will find that all of the recordings, the slides for these lesson sessions will be posted on the Cancer Program website underneath the provider information link. So please do view that and download and use that information in the future to train new staff and so on, especially as we get these topics rolling forward. And there is a list of all the topics coming up until March next year. We do recommend, again, you try and come onto these live sessions. As again, having these staff here to ask questions is a great resource and a great time effort there. But we'll have these sessions for all the other awareness months and different aspects of the program with all how to manage and go through those. So on behalf of all the Cancer Program here in the room and virtually as well, we do thank you for watching this recording. And again, if you have any questions, please reach out to any of the staff on here, our unit manager staff, myself as a screening program supervisor, our data team, program nurses, and our enrollment specialists, and anybody else that you need from the Cancer Program for different aspects of what we do. And so that is all. Thank you very much.